away from. Now, if I need to have you expose the skin in that area during this assessment, would that be okay with you?
That's perfectly all right.
Let me go ahead and have you remove your shirt.
Okay.
I'm going to check the kidney. All right. And then let me go ahead and have you take a seat here.
All right, so I'll begin with the general C scan. I'm going to contact or check SI joints. I'm going to contact the PSIS. I'm going to spring into it in a medial to lateral direction, in a posterior and anterior direction. Feel good joint play. Feel good joint play on the left side. Okay, right here in the lumbars I feel some restriction. Okay. So as I bisect the iliac crest, looks L4, probably like an L4, L5 joint space where I feel restriction. Let me go ahead and have you cross your arms. Okay, I'm going to bring the patient into flexion. Alright, and as I flex the patient forward, I do not feel that joint space open up. So I'm going to check rotation and lateral bending. Okay, so I'm going to set up just off of the spinous, just to the side of the spinous process. And I'm going to rotate the patient. As I rotate the patient, I'm going to spring in a lateral to medial direction. Okay, come around on this side. Alright, and now I'm going to check lateral bending. So the same thing as I laterally bend the patient, I'm going to spring in a lateral to medial direction. Alright, so as I laterally bend the patient to the left, and as I rotate him to the right, that's where I feel the restrictions. I don't feel that joint space open up. So that listing would be a PRI. Alright, I've assessed the lumbars now. I need to continue to the thoracics. Alright. Okay, so right in here I feel some restriction. Alright, so see go to the base of the scapula and bisect it. Puts us at T7, where I felt that restriction would be about T6, T7 space. So what I'm going to have the patient do is cross his arms. Okay, we're going to check for flexion. Alright, and so as the patient flexes forward, I do not feel that joint space open up, so I'm going to check for rotation and lateral bending. Alright, so I'm going to set up just off of the spinous process, just laterally. Okay. I'm going to rotate the patient in a lateral to, as I rotate the patient, I'm going to spring into that joint in a lateral to medial direction. I'm going to come to this side. And now I'm going to check for lateral bending. And as I laterally bend the patient, I'm going to spring in a lateral to medial direction. Check the left side. So as I rotate the patient to the left and as I laterally bend the patient to the left, that's where I feel restriction. That would make that a PLS, but I need to make sure that the associated rib pairs are not involved with that restriction. So I'll go back to, let me go ahead and have you uncross your arms. Alright, get to the base of the scapula, bisect that. That puts us at T7. Alright, so I'm going to come back up 2 interspinous spaces. Alright, and I'm going to laterally come out about 2 inches. I have now contacted the rib. Alright, first thing I'm going to do is check for rib elevation. So if I can have the patient cross his arms, we come around to this side. Alright, to check elevation of the rib, I'm going to be on the inferior aspect of that rib. Okay, and I'm going to flex the patient forward, rotate him, and slightly laterally bend him, and I feel the rib elevate. Now I need to check for depression of the rib. So now I'm on the superior aspect of that rib. I'm going to bring them into extension, rotation, and slight lateral bending, and I feel that rib depress. Alright, now I need to check the other side. Alright, go ahead and uncross your arms. The base of the scapula again. Puts me at T7. 2 interspinous spaces. Out to the right about 2 inches. I've contacted the rib. Again, I'm checking for elevation. And if I can maybe cross your arms. Okay, I'm going to flex the patient, rotate, and slightly lateral bend him, and I feel that rib elevate. Now I'm checking for depression. Extend him, rotate him, and laterally bend him, and I feel that rib depress. Alright, so the ribs feel fine, so they are not part of that restriction. Now I need to continue with this assessment of the cervical spine. So let me go ahead and come in. I feel a little restriction right here. Alright, that seems to be in the C3, C4 spinous space here. Alright, so I'm going to contact there. Alright, I'm now going to have the patient flex his head forward. Okay, and as I have him flex his head forward, I do not feel that joint space open up. Alright, let me go ahead and have you sit on this chair over here. There's a seat. Alright, so I need to check for rotation and lateral bending. Alright, so first thing that I'm going to do is check for the rotation, and I'm just on the contacted the articular pillars about C3, C4. Okay. Rotate to the left, rotate to the right. Okay, and as I rotate them to the right, I feel a little bit of restriction. Alright, now I'm going to check for the lateral bending. Alright, so same thing, I'm going to come there on the articular pillars. Bring his head over with this other hand, and I'm going to come in from a lateral to medial direction. Same thing on this side. Okay, so I notice as I laterally brought his head to the left, there was restriction, and as I rotated them to the right, felt restriction, and that would make it a PRI. That's it. Thank you.